As we grow older, foods that once seemed harmless can begin to affect the body in unexpected ways. Nuts are often promoted as one of the healthiest snacks available, but not all of them support aging muscles, bones, and circulation. In fact, some commonly consumed nuts may quietly increase inflammation, strain vital organs, and interfere with medications. One of the most misunderstood examples is the peanut. Although widely loved and frequently labeled as healthy, peanuts are not true nuts but legumes, and this distinction becomes more important with age. Because they grow underground, peanuts are especially vulnerable to mold contamination. Certain molds can produce aflatoxins, compounds that may slowly burden the liver over time. As the body ages, the liver becomes less efficient at filtering toxins, meaning repeated exposure can lead to fatigue, weaker immunity, and slower recovery. What once caused no noticeable effects may now quietly reduce energy and clarity. Peanuts also contain large amounts of omega-6 fatty acids. While these fats are necessary in small amounts, excessive intake without enough omega-3 south can promote chronic inflammation. This low-grade inflammation often appears as stiff joints, aching muscles, brain fog, or sluggish circulation, making everyday movement feel heavier and less fluid. There is also an important consideration for seniors taking blood-thinning medications. Peanuts naturally contain vitamin K, which may interfere with how these medications work. This interaction can increase the risk of clotting or bleeding issues. Even peanut butter is not always a safe alternative. Many commercial varieties include added sugars, excess salt, and processed oils that strain blood vessels and raise blood pressure. Over time, this combination may quietly harm artery health and reduce endurance. Cashews present a different, but equally important concern. Known for their smooth texture and creamy taste, cashews are often considered gentle and easy to eat. However, for seniors they can pose hidden risks. Cashews are high in oxalates, compounds that bind to calcium in the digestive system and prevent it from being absorbed. This means that even if calcium intake is adequate, bones may still weaken because the mineral never reaches them. As bone density naturally declines with age, blocking calcium absorption can accelerate bone loss and increase fracture risk. Balance may worsen, and even minor falls can become serious. Cashews also contain more carbohydrates than most other nuts, which can cause blood sugar spikes in older adults. These spikes damage small blood vessels over time, particularly in the legs and feet, leading to numbness, slower healing, and reduced circulation. Oxalates may also accumulate in the kidneys, forming stones, especially in seniors who do not drink enough water. Additionally, despite their soft appearance, cashews are dense and can be difficult to chew for individuals with dental issues or reduced jaw strength, increasing choking risk. While cashews may seem harmless, regular consumption can quietly strain bones, kidneys, and blood sugar control. Fortunately, not all nuts have these effects. Some nuts actively support strength, balance, circulation, and brain health. Making the right choices can help preserve independence and mobility as the body ages. Understanding which nuts to avoid and which to embrace can make a meaningful difference in how you move, think, and feel each day. Among the best nuts for seniors, almonds stand out as a powerful ally for aging bodies. Almonds provide calcium and magnesium, two minerals that work together to keep bones strong and flexible. Magnesium helps guide calcium into the bones, while preventing it from hardening in the arteries, supporting both skeletal strength and healthy circulation. Almonds also contain plant-based protein and healthy fats that help maintain muscle mass, which is essential for balance and fall prevention. Regular almond consumption has been linked to better physical performance and functional strength in older adults. Their natural fiber supports digestion, improves nutrient absorption, and helps maintain steady energy levels. Almond skins contain antioxidants that protect brain cells from oxidative stress, which is associated with memory decline and reduced mental clarity. A small daily portion can support both physical and cognitive health without overwhelming the body. Pistachios offer another unique set of benefits. Rich in potassium, they help the body manage sodium levels, supporting stable blood pressure and smooth blood flow. Pistachios also contain lutein and zeaxanthin, nutrients that protect eye health and reduce the risk of age-related vision decline. Strong vision plays a critical role in balance and fall prevention, helping seniors remain confident and independent. Their combination of protein and fiber helps stabilize blood sugar, reducing energy crashes and mental fatigue. The act of shelling pistachios naturally slows eating, encouraging mindful snacking and better portion control. Studies have shown that regular pistachio intake may lower systolic blood pressure, supporting long-term cardiovascular health. Walnuts complete the trio of beneficial nuts for seniors. Rich in plant-based omega-3 fatty acids, walnuts support brain cell structure and reduce inflammation in the nervous system. Research suggests that seniors who consume walnuts regularly perform better on memory tests and experience slower cognitive decline. Walnuts also support heart health by improving cholesterol balance and enhancing blood vessel flexibility. In addition, walnuts contain natural compounds that help regulate sleep, supporting deeper rest and improved mental clarity during the day. Their soft texture makes them easier to chew and digest, even for those with dental sensitivities. Proper storage helps preserve their delicate oils and nutritional value. Choosing the right nuts is not about restriction, but about alignment with the needs of an aging body. Small, consistent choices can protect strength, clarity, and confidence over time. By avoiding nuts that quietly strain the body and embracing those that nourish it, seniors can support healthier movement, sharper thinking, and greater independence.